Good morning, everyone. A live look this morning at a place I know I wish I was at. Many of you, too. This is Fort Myers Beach in Southwest Florida. A few people out there on the beach getting hopefully some sunshine a little bit. No sand and sun here right now, but you may want to get out today, get a little workout in, maybe at least a walk. It could be the key to keeping your memory intact and much more. The morning medical update starts right now. Good morning. It is Friday, March 25th. Thank you so much for joining us right here on Facebook, on YouTube, and now on Twitter. A new study finds fitness may reduce the risk of a dementia by 33%. Today, we're going to talk about that. And we are joined by Dr. Jessica Kalender-Rich, a geriatric medicine and hospice and palliative care physician here at the health system. She's going to tell us why constantly being tired and moving around slowly could be the sign of an early death. And a man who never slows down, even in his mid-70s, former Kansas City sportscaster Frank Boal is here. He's going to share his insight on what helps keep him safe and active and healthy. Also, Dr. Stites is here with his secret to staying young and sharp and fit and beautiful. He's going to share all his secret tips on how he does it. All right, we'll get to that here in just a moment. But in our medical news headlines today, a new blood test developed right here in Missouri could give people an early heads up if they have Alzheimer's. The test from Washington University School of Medicine in St. Louis measures a certain plaque that develops in the brain from Alzheimer's. One really good thing about this test is that it's much more cost effective than the current ways of detection. Climate change is not only affecting water levels, but now a new study published in the Journal of Nature Communications finds it could cause pollen season to start 10 to 40 days earlier and last 5 to 20 days longer. Researchers say pollen levels could triple in some places if carbon emissions are not curbed. And virtual reality is doing more than just offering an escape for some people. Psychologists say they are working on a virtual reality treatment for those who suffer from anorexia. The new therapy aims to familiarize patients with foods that often scare them. Studies have shown a third of anorexia sufferers characterized by restrictive eating and dramatic weight loss relapse within 5 years. Get your questions sent in to us this morning on YouTube, Facebook, and also on the Medical News Network. You can find links to all those right there on your screen. Now, let's get to Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control on this Friday. Good morning to you. What's our COVID count?
Hey, yeah, you know, if moving slowly or getting up and feeling tired is a sign of early mortality, I may not be here on Monday.
I guess so.
I feel that for like the last 2 years.
I hear ya.
We have 17 active infections right now, 1 ICU patient, none on the ventilator, still 53 in that recovery period, a total of 70, but again, 70 active patients currently. So, and we've been discussing that all week about, we know that some of these people are here for COVID. Actually, it's not like during the surge when the majority of them here were for COVID symptoms. But we now also know that the virus is still circulating in the community. Right now, cases are still remaining low. But we would like to get that active infections down, just as we said, to the single digits, or 0 would be great as well.
One of the things we know, Hawk, is that about half those patients that are here because of COVID, and half of them are here with COVID.
Yeah.
I mean, that's different than it was with the Delta variant or the original strains, in which case patients were here really with COVID. And it's probably because, A, the current variant, the Omicron variant, makes people you can be positive and be more asymptomatic. B, if you've been vaccinated, you're more likely to be asymptomatic. And C, even if you've had some natural immunity, you're more likely to be asymptomatic. So you may come in positive, but you may be coming in for your hip surgery or your back surgery. You're positive. We still register you as positive because that's what we're required to do. But the reality is you're not here for COVID specifically. And but on the other hand, we still have half of those patients are here because of COVID.
Yeah.
You have some graphics this morning you want to share?
Do I have graphics?
Do they have graphics?
I don't know. Did we get graphics here today? I don't think we have the graph, really. Did we?
I think they do.
There they go. All right.
You didn't know it, but now you know it.
I did know it. No, I remember seeing it. I just wasn't sure about it because that thing looks like a gas pump there over on the right, or maybe a charging station now. COVID-19 vaccines help protect against the most serious COVID outcomes, even during Omicron. That's a really important study. Actually, there are a couple of really important studies that come out in the last couple of days.
Yeah.
So this one, it demonstrates really clearly that you're 94% less likely to have to go on a ventilator and die. That's kind of the thing we've been saying all along. It is clear that vaccination and boosters really affect your outcome And even if you may come in the hospital or even may get COVID, you're not going to die from COVID. And that's a huge thing. And this was verified as well in a study that was published in the New England Journal of Medicine Wednesday night. And it's a really important study. They looked at the Pfizer vaccine, and it was people who had 2 doses of the Pfizer vaccine could either get a placebo for their booster or a real dose of vaccination to test the real-world effectiveness of booster vaccinations. What they found was almost a 95%, 98% reduction, serious hospitalization and death if you've had the booster vaccination against if you had not had the booster vaccination. So clearly boosters are really important, and that's going to beg the next question, will there be a need for a 4th booster shot or not, or a 4th shot overall? And I don't think we know that yet, Hawk.
Yeah, I think that study, that infographic that we show was good. That was from MMWR this week. Again, the good data continues to support the fact that vaccinations do protect against severe disease, hospitalization, and death. And this is one more thing, even during Omicron. And then just like you talked about, another article in New England Journal this week also showed that those people that had never been infected before and were infected with Omicron developed antibodies only to Omicron. With no neutralizing antibodies to any of the other variants. However, those other people that had been vaccinated previously and developed infection with Omicron also had neutralizing antibodies to BA2 as well. And so that continues to show that vaccination not only provides protection, but also helps increase that robust immune response, not only to the original Wuhan isolate, which the vaccine was made from, the mRNA vaccines, but also now helps clonally expand your immune system and develop antibodies or develop an immune response to the variants that we've known about, but also probably variants that we don't even know about yet.
Right, and they share so many characteristics between that spike protein, as you've talked about so many times, that really, if you work against one, you'll have really pretty good effectiveness against the other. And think about this. This is a study that used a randomized controlled trial, and how much better and different that is than single case reports or what I would call individual, almost stories. You hear the stories about, hey, listen, I gave miniature golf balls to somebody and they got better. Well, okay. Did they get better because you gave them miniature golf balls, or did they get better because our bodies are pretty good at getting better from most infections, and 99 times out of 10 you're going to get better anyway. The problem is that there's so much death that occurs from COVID-19 that you don't want to take the chance that somebody's just saying, hey, I've had these 3 patients, I've given this miniature golf ball to, and they got better. Yeah. That doesn't mean the miniature golf ball really works. Right. Now contrast that with using thousands of studies, you're blinded, you don't know what people got, and then you turn around and you say, look at this overwhelming data. Everybody who got sick were the ones who didn't have a booster or who had not been vaccinated. Whereas if you've been boosted and vaccinated, you don't get sick. Overwhelming evidence, not just whether or not you gave miniature golf balls.
Yeah, and I think that is the message that we need to keep giving. That was actually their conclusion in this study in New England Journal of Medicine. Their last study is that vaccination is still warranted. Vaccination continues to be the safest way to develop immune response and immunity and protect you from the hospitalization, severe disease, and death, rather than just infection alone. So.
All right, we're going to get to our topic here in just a bit. I got some really fun pictures of you.
Oh boy, here we go.
Oh yes, we do. But I do have a testing site update I want to get to all of you. The state of Kansas will close its COVID-19 testing sites next week in Johnson County. The locations at Johnson County Community College in Overland Park and at the Church of Resurrection in Leawood. They're going to stop offering those testing at 6 o'clock on Thursday, March 31st. The Johnson County Health Department will still offer drive-through testing every Wednesday at its building in Olathe. So keep that in mind. Do we have any reporter questions on the line today? All right, we are good. We're moving on. Okay, a brisk walk each day could slash your risk of developing dementia, according to a new study. Researchers say keeping fit into middle age might be the key to staving off Alzheimer's disease. The study from Washington VA Medical Center found people who kept up a decent level of fitness were 33% less likely to develop the disease. Joining us now to talk more about this is Dr. Jessica Kalender-Rich, joining us virtually, and avid fitness guru and well-known Kansas City sportscaster. You know his name and face, Frank Boal. Good morning to you. How are you?
Good morning. Wonderful to be here. Thanks for inviting me. This is great.
Yeah, great to have you in studio.
Yeah.
We might have to put you to work a little bit. How does it feel to be back on the anchor desk, if you will?
Unusual.
Unusual.
Yes.
Good. Okay.
And I'm glad I don't do it every day like I used to. So.
Yeah. Okay. Well,
yeah,
we're
that's the important thing.
Really glad to have you. Dr. Kalender-Rich, I do want to start with you. Good morning to you, by the way.
Good morning.
Hi. Okay. So let's just talk quickly about the COVID virus, the latest, and how it is impacting our senior population.
We continue to see, as you've already discussed, really good effectiveness from the vaccines, especially those people that have received the boosters. And numbers, per usual, reflect what's going on in the community. So as numbers remain low amongst the community, they remain low among older adults. We do see that hospitalizations and more severe infections still continue to be higher amongst those that are higher risk, which I believe is something we would expect. But overall, we're in a much better place than we have been.
That's some good news. A question we get, though, a lot is people requesting a second booster. What advice are you giving to people? What population should be getting that second booster, if at all?
The second booster idea has been explored in other countries at this point and is still being really looked at, right now in the United States. There's some data that suggests that it would potentially decrease risk of infection, but also importantly decrease risk of hospitalization. The challenge is that we really need to figure out a more long-term solution. And so it's not that we're going to be able to keep getting boosters and administering them, every 4 and 6 months perpetually. And until we know exactly how that's going to look, I think the data is still out there.
Yeah, no quick fix.
Well, what I would say is that there are populations we've identified that need a fourth booster in the transplant population,
Okay.
or the severely immunocompromised population, or people undergoing chemotherapy. For that, the fourth booster Hawkeye, we're saying, yeah, let's go ahead. And we're giving fourth booster shots now to all of our lung transplant
And
patients.
age is not a factor with that, correct?
No, it's the level of
Yep.
immunosuppression that's key.
Yeah.
Yep.
All right. Well, one thing that can help, though, is good exercise and staying active. And I know, Dr. Kalender-Rich, that was a concern of yours because our older population oftentimes struggles to get out and to be able to do those things. Let's talk about that, the importance of just the daily exercise that people have been having to stay away from due to COVID, out of the gyms, out of the malls, all that kind of stuff. How important is it?
We know that the more people move, the more they move long term. And so it's critically important for a person's cardiovascular health, for their brain health, as we were discussing today, but also for just their overall health and stamina, that we just have everybody keep moving as much as they can, whether it's in the mall or in the gym or wherever they feel safe. It's a critically important piece. And it's not only those things that I think we think about frequently. It's also in order to reduce the risk of falls, which have a lot of downstream effects related to somebody's overall health.
And what type of exercise makes a difference? I mean, every little bit helps. I mean, we had a guest on here yesterday that climbed a mountain. Frank Boal's doing the same type of things. He's out there climbing mountains and running. But you're not saying that people have to do this type of extreme exercise. Movement matters. What specifically can they do to really make a difference?
Yeah, so you make a really great point. Movement is what matters. People need to find the thing that keeps them moving and that they can continue to do in a consistent manner. So there have been studies done looking specifically at, the strength training versus cardiovascular training versus just flexibility change the way that we can continue to move ongoing and continue to prevent those declines that we've talked about. And what they have found consistently is that the most important thing is to keep moving and to do something as often as you can and to do it consistently. It doesn't matter what that thing is. So if walking is your thing, do it. If mountain climbing is your thing, go for it.
Go for it. Okay, Frank Boal, I'm going to bring you in because you've been doing all sorts of stuff, half marathons. You're 75 years old. I love it that I get to walk in and say, "How old are you?"
Yeah,
I don't get to do that to many guests.
Well, that's a terrible question. Yeah,
It
no,
is,
I'm
but
only kidding.
it counts today. So because it matters. I mean, we've seen you on television for 30, 40 years,
Yeah.
a few decades.
Maybe too long. In some
Maybe
people's
no,
minds.
no. We know that voice and that face, so we're so glad you're here. So tell us a little bit about how staying active has just really made a difference. Certainly, now that you're semi-retired, I know you're still out there a bit, but staying fit and making that a part of your life, how has that made a difference for you?
It's made a tremendous difference for me. Staying fit. I've been fit basically, try to stay fit most of my life. I played football for a long period of time, and just it became a thing for me. Ran track, did all those sorts of things. So it was always sort of ingrained in my system a little bit to try to stay physically fit. And it has always helped me with the business that I was in. When you're in radio and TV and doing all the stuff that we're doing, your hours are terrible. Your eating habits are terrible, by the way. Terrible snacker here. But the idea of trying to stay physically fit and staying on top of it mentally was very, very important. And I know this is sort of counterintuitive, but the more you work out in the better physical condition you're in, the less tired you are. I mean, you generate
the energy.
Your system and your energy just gets all pumped up that way.
What do you do? Yes.
I was going to say two things. First, some of us have to work out not because we've done it all our lives, because our wives throw us out of the house when we're grouchy.
Yeah,
and they're like, you've got to go. Yeah, that is a true thing. And the second thing is, it's pretty cool. He can wear blue jeans in the studio.
I know.
Can I wear blue jeans in the studio?
Don't even think about it. It's not happening. Nice try.
I asked about the dress day, and
I think when you're 75, you can
forever.
You do it in place.
So he said casual. I said, okay. I'm on my way in.
He's a little bit older than you, and he's worked longer, and he's retired.
Hey, I had to wear a suit and tie every day.
He's earned the jeans. He has earned the jeans.
Fine.
I want to ask both of you, though. Okay, so what are you doing daily? Dr. Kalender-Rich said consistency is the key. What do you do daily? What would that look like?
Every day, I walk basically between 4 and 6 miles every day. I used to run all the time, basically almost the same distance, okay? And I find out really that you're running 4 to 6 miles a day. It takes you about an hour or a little bit. Now you walk 4 to 6 miles a day. It takes a lot longer. But I have a lot longer period of time to do it. So the other thing I do is I do not belong to a gym. I never have. I have some weights at home that I use. Okay, just light weights. I don't use anything big or whatever. In order to get a little weight bearing, I usually wear a backpack in the beginning of the year, starts out about 10, 12 pounds, ends up at about 30 or 40 pounds because I end up hiking in the mountains with a backpack that weighs about that much. I do not run anymore. I only walk at this period of time. So I quit the running a few years ago, started to get some aches and pains, my ACL, my patellar tendon, things of that nature started to tweak a little bit. And I said, you're getting a little older, so it's time to maybe try something else.
What the orthopedic surgeons will tell you that is 60 may be the new 40, but your joints are still 60.
Yeah.
Whether you like it or not.
And so the problem with running is after a while that impact does affect your joint space. And that's why we start saying to a lot of people, it's not, you don't need to run. You find other things that are a little more low impact.
Yeah.
The important is, as JKR said a little bit ago, it's really about movement. And whatever you do, that 20 or 30 minutes a day. I mean, I try to exercise at least 5 days a week. I didn't get up this morning in time to do it. I had a workout script that I didn't make it, but I'll try and do it when I get home. But I think I like to change it up. And I think the point is you're moving, and I think that's key. And I know, Hawkeye, you're a big avid exerciser too.
Yeah, no, I would agree. I think just exactly what you said, and we've heard the orthopedic surgeons say that. I think it's good. Continue to be healthy, but there is that impact there, and but find those ways, and it is variable, and it's individual for every person on what is the best thing for them to do that exercise and stay fit, and of course diet is a large part as well.
And the best form of exercise for any individual is the one they'll do.
Yeah.
It's not, you don't have to do this one or you don't have to do that one. It's the one you'll do, and that does make a difference.
So Dr. Kalender-Rich, jump back in here with us. How does exercise help us stay sharp, help our brains? We know those are aging right along with our joints and our bodies.
What we have found, or what we have found in research is that actually as we get older, the neuroplasticity of our brains decreases a little bit. So that's why sometimes we move a little slower. It's a little bit harder to create new memories and learn new things. But we know that exercise actually increases our ability for our brains to remain more plastic or more flexible, and to continue to learn those things and keep those neurons firing.
Frank, tell us about the Colorado 14ers.
Yeah, the 14ers. I've been vacationing in Colorado with the family for many, many years. And it was always, you'd go to the resort areas and you'd be there. And I'd always look up and go, I'd really like to try to
What's
get
up there?
on top of those things. And in 2006, I started to hear about these things called the Colorado 14ers. They are 58 14,000-foot peaks or higher in the state of Colorado. So they call the people that go up there, the nuts like me, they call us peak baggers. And I got my first one at my Bierstadt right outside Georgetown. And after that, I really got hooked on it. And the thing I found, and I think for a lot of people this is important, is to have a goal about your exercise a little bit. Not just, well, I want to lose weight because it's my 50 or 30 or 40 year reunion or whatever. Just have a goal of some kind, a physical goal. Like I ran a lot of Hospital Hill half marathons. You have to prepare to do that. I mean, you really have to run and get your exercise in and do all your things. And Colorado 14ers are the same thing. And so that's why I started wearing a backpack and doing all that. And I really love to do it. I only go out and do it once a year. But all year I work out anticipating I'm going to have to go out there and do that.
What about you? What are you doing? You go to the gym in the morning, is that right?
Yeah, a lot. Well,
and you bike?
I bike, and I do spinning class, and I do lifts. I do a bar class. I do Pilates class, and a lot of them I do now at my home. I put a small. I kind of got some exercise stuff, and I'm at home. There's so many great programs online that I can do them. It's a little more flexible. So I still like to go to the gym. COVID's made it a little bit more difficult, right? But in general, I've spent a lot of time, oh boy, there we are. This is a nice biking. This is my family, and we are biking in this place. And I believe that's my son, and we're out on a bike trail. I think that one is in Wisconsin, if I remember correctly. Nice. There's a beautiful bike trail. It's a lot like the Katy Trail up in the Driftless region of Wisconsin. And so we had our whole family up there doing that. And we just love going outdoors. And fly fishing is a great activity. People think, well, you're standing around. I am more tired at the end of a day of fly fishing because if you're wading, you go up and down. You're trying to balance on the rocks. It's an incredible core strength and conditioning exercise. And of course,
you guys have his fly fishing photos.
If you catch a lot of fish, you're using your biceps.
Well, that's what I was going to say. Those looked big.
There's the biceps.
You did send me some pictures, and you were holding up this big
curls.
Fish
Curls. That's the carp curl. I had a carp curl on.
Or the northern pike.
Yeah,
exactly.
Or carp in this case. I showed a picture of me catching a carp, and which is actually hard to do on a fly rod. And but it's a carp curl, holding that thing up.
Love it, Dr. Kalender-Rich. When we show those photos of everyone being outside, fresh air, sunshine, taking time away with our family, unplugging a little bit, how much difference does that make to really make an effort to do those things and to put those things in our schedules? What kind of difference does that make?
Yeah, I mean, it's critical, right? Those things are critically important for our physical health, for our mental health, and really just for our motivation to keep on going. And I like the idea that Frank shared about having a goal, right? So for many people, for my own parent, the goal was always, we're going skiing every year. I've skied my whole life. I'm taking my grandkids skiing. And so he would work towards being able to ski with those grandkids every year. And really all of those things put together help really a person stay in their best overall being.
Well, Dr. Hawkinson mentioned it off the top of the show. It's that feeling of you never know. You just always kind of feel tired. I always wonder sometimes if this is just the way you're supposed to feel at whatever age you are. How do you keep from feeling tired? Is there anything you do? I know the consistency in your exercise, but just that feeling of being tired all the time. Any advice you have for people of any age?
Well, you've got to sleep well. Okay, that's number one. I think you've got to get your sleep. You've got to get your rest. And there are a lot of things that take away from us in there. You've got anxiety and stress and family and the job, everything of that nature runs around in your head every night as you try to decompress and try to get a good night's sleep. I try to get a good night's sleep. Now, me being my age and where I am in life, I can also take a little bit of a power nap in the afternoon as well. But I try not to, if I do that, I try not to be there any more than 30 minutes. I just try to maybe relax my brain, put my head back. I do it in bed, and I don't do it on a couch or a chair. And I do it in bed, and 20, 30 minutes, and I'm up and I'm out. If you spend an hour there, an hour and a half, then you're going to take away from the kind of sleep you're trying to get at night, I think.
Just one thing. As you get older, your liver slows down. Mm-hmm. All right? Your liver slows down. What does that mean? You got to be a little more careful with what you take in because it's harder for your body to get it back out. And JKR can comment on the Jessica Kalender-Rich can comment a little bit to that. Sorry, I call you JKR. Have for years. And so especially things like alcohol, it doesn't take nearly as much alcohol to begin to affect you. It's going to hang around longer. You just have to be thoughtful. So part of the key to staying healthy as you get older, I know nobody likes to hear this, but it's moderation, but moderation means less the older you get. And exercise means actually more because it's harder to get in shape, it's harder to stay in shape, and it's easier to fall out of shape because we're older and our bodies not only lose that brain flexibility and our brain acuity, but think about that in every joint, in every organ of your body. So the best message we can give you is, wait a minute, it's what you don't want to hear. Don't drink, don't smoke, exercise, eat healthy.
Boo.
Jess?
Boo.
Back me up, JKR. Back me up.
Right.
Show me the love here.
I mean, you got it, right? And I think that's true. Even we know that even as younger people, that really sort of predicts the way in which that we age. And so doing those things from middle age and younger on will help people continue to have all of the benefits even as they move later on.
That's hard for people, except people like Dr. Hawkinson. All right, what's your big secret? How do you do it?
Me?
What do you do to stay fit?
Well, the first thing I think, I know, the first thing, I think when we talk about just tired, I think there's just a general tiredness. And I think exercise, getting out, getting your heart pumping, that will decrease your overall general tiredness. And then there's the tiredness we talk about maybe during the day where you need a power nap or just to chill and relax for a little bit. Those are two different things. But when you start to exercise and get your blood pumping and your blood pumping through your body and through your brain, that overall general tiredness, I think, goes away. I had to start working out now because, again, a few weeks back, one of my patients told me that I look fat on TV. So I've been doing that. Thanks to him. I took his I took his comment to heart. So
nothing wrong with a little vanity motivation.
That's all right. Okay.
No matter what motivates you, that's perfect.
That's right.
But you walk, right? Tell me some of the things you do. You walk, you go to the gym, you mix it up, right?
Yeah, probably since about January I've been doing 5 in the morning and then in the afternoon too, running, walking,
and you
weights.
took a new look at your diet too, right? Tell us about that.
Yeah, I mean, it's just healthy. We know healthy diets. I think most people would say one of the most healthy diets you can use is the Mediterranean diet. That's not what I'm doing, but I think it's cutting out those carbs and those excess calories. It's trying to shop around the outside of the grocery store, the outside aisle, rather than the middle aisles, where you have the fresh fruits, vegetables, meats. We know, unfortunately, now all of those things are increasing in price. So it is a lot cheaper to eat those things that are more processed and in those aisles in the grocery store. But there are other cheap ways to be able to do that and eat healthy, those fresh products, the vegetables, the fruits, meats, all those things. So.
Dr. Kalender-Rich, talk to us about diet as we age and the importance of that, and maybe taking a look at what we're eating or what we need to be eating more of or less of. What are those effects?
So it turns out as you get older, you still need the same nutrients that you had when you were younger. I know, wow. But right? But
I know.
What happens frequently is a person's diet changes or their taste buds actually will change. And so it will make it more difficult to find the things that seem more tasty, then continue to really satiate them. And so people will often perhaps eat less or eat different things or go for things that are much more salty or much more sweet because of those changes in their taste buds. And so that makes it even more important to really buckle down and figure out which things are more healthful and continue to consume those. many people will jump and try to take a lot of supplements and multivitamins and think that they can make it up in that way. And while those things do help, really the best thing that we can do is eat a well-rounded diet that's full of those fresh fruits, veggies, and all the things that really are known to be healthy.
I want to talk about supplements. But
I was saying protein is still really important as you get older, but be careful with salt and fat. We know those things your body doesn't tolerate as much. And also remember that our metabolism does slow as you get older. So even though you may still be hungry, your body may need fewer calories as we get older to maintain your weight. And that's one of the other struggles I think folks have, is that if you become less active, and you don't need as many calories because your what we call the resting energy expenditure, how much your body uses in calories just at rest, which is because your body, we think about, exercise, I want to burn off all these calories. The reality is you burn 90% of your calories because your body's got to maintain all of its functions, whether it's the muscle holding your head up or it's your heart beating or your brain, which actually consumes an overwhelming amount of the energy in your body, slows down. All those things affect how many calories you're going to take, and so that means how many calories you can take in. So you have to be careful of that, and you got to make sure, as Dr. Kalender-Rich has said, making sure you eat the healthier food groups, shopping around the grocery store, not in the middle of the grocery store, makes all the difference.
Frank, how has your diet changed over the years? Are there things that you've had to take a look at and go,
Don't talk to me about diet.
That's off limits, right? Age is okay.
I have a terrible sweet tooth.
Yeah,
okay, just
it's
terrible.
tough.
And I have, I think, almost all my life. I can remember my mom used to put out these, the spearmint leaves and the orange slices and all those.
Yeah, those are
things.
great.
They'd be all around the house because my dad would snack on them all the time. So naturally, you're a little kid, you're going, wow, this is great. And then the bad cereals back in the day when we didn't know, at our age, that this is just what moms and dads did and the whole thing. But my diet could be a lot better. Yeah.
Bacon is an essential food group. I will say that. I could talk about how healthy I try to eat, but bacon is an essential food group.
Can we get Dr. Kalender-Rich to confirm that for us, please?
I'm not sure. What I will add to this conversation is that the key really is for weight stability. So we want to achieve a healthy weight and then maintain that weight. We don't want to see our older adults really losing a lot of weight. This is really the only time where that extra 5 pounds on the hips can actually be protective. Notice I said 5 and not 50. But we want to maintain our weight, right? We want to have that stable level.
All right, we're going to get to some community questions here in just a moment, but I do want to touch on supplements. Not all supplements are created equal. Dr. Kalender-Rich, what should we know about that? And when do we know to take them?
It's a really good question. First, I think it's important to always talk to your primary care provider about what things you're taking, because certainly there are opportunities for interactions or perhaps the doses to be out of whack or too much for a person dependent on their other medical conditions. But certainly, a multivitamin is always good, one that focuses in on things that older adults need. So older adults are going to always need a little more calcium, a little more vitamin D, a little more B vitamins, especially B12. Those are things that are going to be good long term. But there are also things you can get in your diet if you're being careful.
All right, let's get to our community questions, shall we? Okay, Georgianne wants to know, how can a deconditioned person over 65 start to get back into shape? Frank, I'm going to ask you, but Dr. Kalender-Rich, where would you suggest someone start?
So I think this is an example of starting where a person is, right? So if a person can walk 2 blocks, then they start walking 2 blocks and then they add on a 3rd block and keep getting farther and farther and doing more. We know that, to Dr. Steitz's point earlier, our muscles just don't stay in shape as we get older. They have to be kept in shape. And so you can build that up. It is going to be harder when you're 80 than it was when you were 40 or 30 to build those things back up. But it definitely is possible and can still provide a lot of those protective effects that we've discussed.
Frank, people probably ask your advice or how you do it. So what advice would you have for someone trying to just start and get out there?
Well, I think it's like anybody. Number one, you better check with your doctor. Okay, that's number one, and see where you are physically, especially with your heart. If you got aches and pains in the lower part of your body, you got bad hips or bad knees or a bad ankle or a bad foot, it's going to be extremely difficult for you to get up off the couch and get out and go do things. And the other thing I say, to me, and I know motivation sometimes for people is to go to a gym and be in there with other people, but you can walk right outside your front door. Right outside your front door and just go from there. And if you're going to walk a couple blocks and you're worried about being on the concrete or something like that, remember those grassy areas? You got to be careful because it's a little bit different. It's uneven surface, but to do that, to be able to just get out there and start and walk away from your house. I always work out, like it's always out of my house. Go away from the house because you got to come back. So if you're going to go 2 blocks, then turn around. Remember, you got 4 blocks coming.
Exactly.
One of the most complaints in a lung clinic, pulmonary clinic, is, doctor, I'm short of breath, right? And the number one cause of shortness of breath is deconditioning. And so the best way to address that, and we tell people this all the time, how do you get back in shape when you either A, have never been in shape or you're just out of shape? And I think what Dr. Kalender-Rich says, right, you've got to meet it where you are. And so if that means you can walk 1 block and then you have to stop and rest. Okay, walk a block, stop and rest. Then I love the walk back home because we tell people that all the time. And almost everybody can find a place to walk. And then folks will say, yeah, but, it's too cold. Well, okay, there's Walmart. And if you're short of breath at a block, you're going to have a hard time getting around the Walmart. And, Walmart still welcomes people to come in and walk. And so, find a place where you can go and walk until you can't, you have to stop and rest and then walk back. And if you do that consistently, and you say, I'm going to walk 2 feet more or 10 steps more, eventually you end up, you can get back to walking a really long way, even at age 80. But you've got to start someplace, and you just start where you are, and you try and gradually increase it every time you go back out, and you will build up, and you will feel better, and you will live longer. I mean, it's just the effects of exercise are very pronounced as we get older.
Dr. Kalender-Rich, can people work their way and exercise their way off medications as they get older? I know there's some that are just necessary and very good, and people need to stay on them lifelong. But are there some things, is that a goal that somebody who's aging should be looking for? If I change my diet and I change my exercise habits, that maybe I can come off some of these medications?
Yes. I mean, in the same way that we can do that when we're young, right? So if a person is moving more and their blood pressure may go down or their blood sugars may improve, they can often get off of many of those medications. And the truth is, as we get older, a lot of medications have more side effects than they might have as we're younger. And so to get off of some of them and to get away from some of those potential interactions can be really fabulous. I really like to stop medications on people. It's like my favorite thing to do. But in order to do it, people have to really be in the right place with their health.
Yeah, they have to do the work at home. Frank, have you been able to stay away from medications or get off of some?
I'm just blessed, I guess. Genetics, whatever.
Yeah.
I'm on no medications at the moment.
Fantastic.
So, yeah, it's great. And I really try to stay off of anything, even when I get aches and pains. I try not to take the ibuprofen, the acetaminophen. Try to stay away from that. I'm using some CBD stuff now. I used the topical from CBD American Shaman. Not that I'm trying to build them up, but they've been great. I use topical creams to help with pain because I have some arthritis in both of my fingers here. But I think that's from playing golf.
God, you're doing
more than anything else. So
all natural.
Yeah, I'm pretty blessed at the moment.
Okay, I do have a couple of COVID questions I do need to ask. Dr. Hawkinson, Jean wants to know, will there ever be a time that cloth masks will be enough? That we won't have to wear anything more than that? I mean, I think people are hoping they'll go away altogether, but is cloth enough?
I think I think yes. I think this is a question that we've been asked and has been investigated, and we know that different masks provide different protection. I think we have to define what is enough. We know that certainly the N95 masks provide the best protection for filtration against particles. Surgical masks are better, and cloth masks, those 2 to 3 ply cloth masks with a good fit, continue to provide protection as well. I think we have to, again, define what is enough, but every little bit helps. And if you don't have a surgical mask or an N95 mask and you're going into those riskier situations, then that 2 to 3 ply cloth mask is going to help you. Again, that's also in addition to the other public health guidance points, just like distancing, try to be outdoors if you can, and of course being up to date with your vaccination. But I think we just have to get to the definition of what do you mean enough. We know that the protection from those other masks is better, but a little bit of protection from those cloth masks is still better than nothing.
And just quickly, Dr. Stites, Lesko wants to know just your thoughts on these airlines possibly going away with masks. What do you think that will mean down the road?
Yeah, I think we don't know what it's going to mean. I think it's, airlines are closely packed. They've really improved their airflow. We've talked about that before. But when you take masks off, the person's next to you is sick. I don't know how well the airflow. I don't think we know enough yet. Okay. I'm nervous about the airline mask coming off myself, and I'll probably wear one for a while until I see what the data looks like. But I think that the time's going to come, and we're probably going to test it, I guess. But I think we don't really know.
Hey, Frank, so how did COVID affect your activity? Did the pandemic slow you down at all? Did it keep you from doing things, or did you just get more creative?
No, like I said, I was never going to the gym anyway, so it didn't matter to me, and I just put my dog on a leash and we go. And she's waiting at the door. God bless her. She's waiting at the door wagging her tail and going, come on, let's go. So she's part of my motivation. But no, it really didn't slow me down that much.
Yeah, somebody was asking, do you do all your walking outside? How do you make sure that you're doing that safely? What advice would you have for people who want to head out?
Well, know where you are. I mean, if you're doing it in your neighborhood, you know your neighbors or whatever. Just, be careful. If you're going to get out on a trail by yourself sometimes, that is maybe a little bit different, but you can definitely walk in your neighborhood, and 99% of people have their dogs. If you worry about dogs or things of that nature, most of them have them fenced in or they're leashed in their backyard, so you don't have to worry about them chasing you too much. But that's the only thing I'd say. I'd be familiar with your surroundings, and remember the biggest gym in the world is right outside your front door.
Yep, love it.
So.
The thing just to point out, Jess, is that, and our Jess and Jessica, one of the most common complaints I see in my patients who are walking and doing some exercise is that their feet and ankles and knees start to hurt. Mm-hmm. One of the most important things you have to do is have a decent pair of shoes. And Dr. Kalender-Rich, I'd love to hear your comment about this. I tell my patients, look, your shoes are good for every 6 months. You don't have to spend $200 on a decent pair of tennis shoes, though. You can get almost all the protection you need from walking for $30, $40, $50, and then try to replace them. But don't think you have to spend a gazillion dollars on the super high fancy marathon shoes, Jess.
No, I agree. Any shoes that have good support and good soles. And we always look at the actual fit a little bit. So, some people have wider toe boxes or their area near their toes, and we want to be sure that nothing is rubbing, right? So something that we don't want to happen as you're out moving and walking more is getting a wound or something on that foot that's just going to set you back. So a good fitting pair of shoes is way more important than buying those fancy schmancy expensive shoes that are out there.
Frank, do you have fancy schmancies?
No, I don't have fancy schmancies. The deal is for shoes, you have to sort of keep track, and I know you will if you get outside the house or whatever. You know approximately how far you walk, and figure it out. A block is about 1/10 of a mile, and 10 blocks is a mile. You'll figure it out as you go. But shoes are only good for between 300 and 350 miles. And if you didn't have any pain for a while, and all of a sudden you get a little pain, it could be your shoes. Okay, just like yes, all the time. Hold on, I'll put it this way: it's your shoes.
There
yes.
You
go. Okay, yeah.
Shoes.
Because all you have to do is look at your soles of your shoes, and you can see the wear underneath. And some even have those little. You see the
wear
little
bars.
Blue or red marks. And as soon as they get worn down and worn off, your shoes are done.
You gotta let it go.
Let it go.
It's worth it.
Get
it's
a new
worth
pair.
it. No, I'm glad you both brought that up. That's really good advice. Last question, though, is from Melissa. And Dr. Kalender-Rich, I'm going to give this to you. She says with her kids and her work schedule, she tries to do yoga every day at home. She works up a sweat. She's in her routine and doing it consistently. But she said that some people wonder if she's really, have asked her, are you really getting a workout with yoga? What do you think about that? You said consistency is the key.
Yoga is a workout. I mean, if you think about it, everything that we do that moves our body and gets our heart rate up is really a workout. And in doing something like yoga, you're really combining the flexibility and the strength, and depending on how you're doing it, perhaps some cardiovascular fitness. But those things are really important moving forward and moving on. And the truth is, when it all comes down to it, the thing that you can do and can continue to do is the key for all of it.
do what's good for you. Do what you like doing. You do yoga.
I do some yoga, as a matter of fact. Yeah.
Like downward dog
good.
yoga?
I've done downward. I can do a downward dog. You bet.
Wow, I'd like to see
No,
that.
actually, you don't.
No, things we should never see. Dr. Sykes doing a downward
Happy
dog.
baby, is that the other one?
I can do that too.
Okay,
Yeah.
we will take your word for it.
Yeah, yoga's good stuff. I'm more of a Pilates guy, but yoga's good.
Okay,
I do some
Pilates,
yoga.
yeah, that's good.
Yep.
Pilates is definitely
Yeah,
a workout.
core strength. Very
Yeah.
good.
Core
Do you do
strength.
stretching and things like that?
Yeah, I try. I don't stretch as much as I should. I should stretch a lot more than I do.
I know, we all should,
Yeah,
right?
I really should. I have bands and all that at home, but sometimes just okay. I'm gonna go.
You
And
look at 'em
usually
over
the
the
most
corner.
important time stretch is not before you go, is after you
yeah.
get done. Yeah.
Well, let's get to some final thoughts. Dr. Kalender-Rich, let's start with you. What should people know as we start aging, but, we still feel young inside, but our bodies say something else?
I think the theme that we have really talked about in this session has really been about movement, right? So the thing to remember and to take away is that to keep moving, you have to keep moving. You don't want to lose that ability. And anything that you do to maintain your mobility and strength and flexibility is the key.
Always great to have you on, Doctor. Thank you so much for that. Frank, I'm going to get your final thoughts, but before you give your thoughts, just quickly tell us what you've been doing. I know you're retired, but that really never is the case, right?
Yeah, right. I was just trying to think back. I think it was 2017. I retired from television, but I still do radio. And just this might go in with the final thoughts thing. I've been very blessed again to be in a business that I really love and be able to continue on at my age in a business that, as you know, is a young person's business. Okay, what they want to talk to me about, I have no idea, but I hope they keep asking me. But the idea is it still keeps my brain functioning because I still have to study, keep up to date on the things we are doing, and mine's sports. So that's a pretty easy thing to do. But I would tell anybody out there, when you retire, don't sit down. Just don't sit down and, wow, what's next? Sort of have a plan, what's next? Something that you haven't done that you'd really enjoy, whether it's volunteering or whatever. Read as much as you can. I'm not just talking about the newspaper. Read something that makes you think. And I think the more stimulus you have in your brain, the better off you are. And exercise and all that really helps. So.
What a pleasure having you here.
Well, it's been great. Thanks
Nice
for
to have a
inviting me.
professional anchor sitting.
Okay.
No, I'm kidding.
Wow, there's a shot.
Totally admit it.
Wow.
Totally admit
Ah,
it.
you know I love you.
Yeah, I know you do.
No.
But I'm
We've turned him into an anchor in the
rank
last year.
amateur.
As often as I
Rank
see
amateur.
these two guys, I see these
They
two
are.
guys more. I told them both more than Dr. Fauci.
Absolutely. No, we have put you guys through the journalism TV school in 2 years.
That's what we've got.
That's right.
It's all about
You've
experience.
got it. All right, Dr. Hawkinson, what's your final thoughts? What advice would you have for someone to try to stay young and fit?
Yeah, I think the best advice came from our guests and Dr. Stites when it said, it is tough. Everybody is tired. We know the pandemic has really taken a toll on everybody physically, mentally, spiritually. The best thing to do is just try to get up and do it. And it might be just a couple steps the first day, and the next day it's a few more steps, and then it's a few more feet, and then it's a block. And it just takes that ability and that motivation to be able to do that. There will be gains, but they may be smaller, they may be large, but just doing that every day and trying to do more after that, day after day.
You're my favorite co-anchor.
Oh, yeah. Well, I got a couple of quick thoughts for you, girl.
Come here.
Your favorite co-anchor that's here right now.
That's right.
Sitting here at
Who
this
happens to be
desk.
just sitting to her right,
Right.
3 feet over right now. That's right.
Right at this
That's
minute.
right.
Okay, final thoughts.
Yeah, a couple quick things. So first of all, do you know what's special about JKR? There are many things special,
I
but
know.
do you know what she did?
What?
On this program early on?
Yeah.
She's the one that introduced the phrase to us.
Mm-hmm.
We're building the airplane while we fly it. Thank you. We've stolen and used that 1,000 times if we've used it even
And you
once.
give her
all the
credit
time.
all the time.
All the time. Second thing. We tell you the best thing you can do to take care of yourself around COVID-19 is follow the rules of infection control, that you have the power. It's within you. And I'm going to tell you the same thing about aging. The fountain of youth isn't a destination. The fountain of youth is inside you. It's what you do every day to take care of yourself and set yourself up for the next day. And the way you can do that, whether you're 75 or 62 or 22 or however old he is.
It's 20. I'm 23.
Yeah, okay, sorry. is to make sure you take care of yourself by doing the basic things, right? Eat right, exercise, move, stimulate your brain, because all of it matters. And it matters for your mental health, it matters for your emotional health, it matters for your physical health, and it's all the same story we've been telling you since the beginning of this program. We won't flapjack you. We're going to tell you the truth. We're not going to jack with it. We're not going to flap our arms wildly. We're telling you the truth right now about movement and exercise. It's all within you. I feel like a Disney show right now.
All right, March 30th is National Doctors Day, and here's a way you can say thank you to all healthcare workers out there. Many of you ask how you can show your gratitude. Well, here's how you can right now. Right there on your screen is a QR code. Just open your camera and hover that right over that QR code, and it's going to take you to your email. You can send in a nice note that we'll read here on air, or you can send in a 30-second video. We would love to share those and share your gratitude. All right, I got to do my best, Frank Boal. I don't know. I got to read sports in front of Frank Boal. How am I supposed to do this? Okay, before we go, live look in Lawrence this morning, thanks to KSNT TV. You are looking at the KU campus, which could be celebrating a trip to the Elite Eight after tonight, though. The number 1 seeded Jayhawks face 4 seed Providence tonight in the Sweet 16. Tip-off is set for 6:30. KU has advanced to 32 rounds of 16, 23 Sweet 16 contests, 15 Final Fours, and 3 of their 5 national championships have been in NCAA championship format. Go Jayhawks. How'd I do?
Rock chop.
I went to Villanova.
I
We already won last night.
They're dangerous.
You have no Kansas favorites.
We're on a collision course for the Final Four if they both go. If Kansas and Villanova both go.
Do you like talking sports a lot?
Oh, yeah.
You do?
Oh,
okay.
Sure. It's been my life. I hope so.
Yeah.
Okay. I know.
If I didn't, I've been a miserable guy.
Is that when people come up to you on the street, do they still just want to talk your ear off about sports?
Oh,
what
yeah.
You think?
Yeah,
and
sure. Absolutely.
Like Dr. Stites asking you about, Tyreek and...
Oh, yeah. No, it's
Good
okay.
trade. We did fine. We're going to be back.
Yeah.
He's
like all the rest of Chiefs fans now. He's over it.
You got to move on.
That's right. Move on, man.
Andy
You know
Reid
what? We still have Pat Mahomes.
Absolutely. That's your boy. That's your boy. All right, everyone. Thanks so much for being with us today. Don't forget, you can catch our show anytime by logging on to Facebook, YouTube, and now on Twitter. Coming up on Monday, it's a gene that 1 in every 300 of us carry. It's hereditary, and it increases your chance for colon cancer. And you may not even know you have it. It's called Lynch syndrome. Our experts answer your questions and take us on a tour through that right there, a giant inflatable colon. We will take you deep inside on Monday. Have a great weekend. We'll see you back here Monday at 8.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.